In-office whitening compared to over-the-counter, we just have access to a better whitening system that's not available to the public. So when you purchase Crest white strips or any white strips over the counter, they're required by the FCC to have a certain amount of hydrogen peroxide within that product. We're able to have access to a different type of hydrogen peroxide, and depending on what your needs are, we can customize your whitening to you. Not every stain is the same, and not everybody requires the same amount of whitening. And so that has to be determined by a dentist or a professional in order for us to let you know what type of whitening you need, how long, and then how long it would last. So one of the mistakes that somebody uses whenever you're using over the counter is that they put it over their gums, and oftentimes they create a chemical burn in the area. Oftentimes they don't use any desensitizer, so something like Sensodyne works very well. But compared to the over-the-counter ones, compared to the ones that we make you custom trays that allow you to place the whitening on the tooth only, and it doesn't get into the gums. Plus, we give you a desensitizer. So we use a branded product called Core Whitening. That one is guaranteed to whiten your teeth. It's the best one in the country, and it's the only one that whitens tetracycline stain. If anybody knows what that is, and so that's the darkest stain out there. And so there's just no way that you're going to whiten tetracycline stain when it comes to over-the-counter products. You have to get that in a dental office, and Core is the only one that can provide that for you. When it comes to the in-office whitening, there are 3 different tiers. The first tier is tier 1, what we call Core Max, is where you whiten at home for about 2 weeks. We make you custom trays, and you come back for the power bleaching. At that power bleaching appointment, we'll compare your tooth color from before you started whitening to after, and oftentimes we can get you to that bleach shade that you'd like. And that's usually somebody who has lighter teeth. They don't need so much whitening. Then we have tier 2, which is the Core Ultra. Core Ultra requires you to have a conditioning appointment, which is 220. Core, we'll have to edit that out. But Core Ultra is 2 20-minute sessions, and we use your current trays, and that prepares your teeth for whitening. And you whiten at home for about 4 weeks, come back for the power bleaching appointment, which is about an hour. And again, we'll be able to get you that white shade. Again, once again, comparing your previous shade to your current shade. And lastly is the tetracycline stain or Ultra T. And tetracycline stain, we do the same thing as Ultra, which is the whitening, the conditioning appointment. However, you're going to whiten for 6 weeks, and then you're going to do the power bleaching at the very end. Again, it's guaranteed to whiten. So for patients who are suffering from tetracycline stain, oftentimes these patients were born with this, and they just had dark teeth their entire life, and they just could not get rid of it. And so a lot of times we can just get rid of that in a matter of a couple of weeks, and it's less costly than a mouthful of veneers. So when it comes to over-the-counter whitening and then professional whitening, the professional whitening is a slow release product. So those are carbamide peroxide. And what that does is it slowly goes into the tooth enamel, and it penetrates and it gets into the dentin. The actual tooth color comes from the dentin, which is the second layer of your tooth. The hydrogen peroxide does the same thing. However, it only works for an hour. The one that we use, it works for about 4 hours. So oftentimes you'll sleep with it, and it works overnight. And so when you have a slow release product like that, it tends to last much, much longer. And the type of whitening that it does, or the type of stains that it removes, is coffee stains, tea stains. It removes in stains that penetrated the tooth. It doesn't remove outer stains. That's going to be done by your hygienist, scraping and polishing. However, these deeper stains are removed by the product itself. So when it comes to professional whitening, how long does it last? This is a question I get often, is that this can last your entire life, because you leave with these custom trays, and then you'll have a maintenance kit. That maintenance kit you'll bleach once a night, one time a month, and from there you're able to maintain those white teeth. So as long as you follow that protocol, you'll be able to maintain that for the rest of your life, and you should only need it for that one time in your life. Now, if you're a heavy smoker, heavy coffee drinker, it still will keep your teeth white. However, you may need to do a touch-up after that. So when it comes to confidence in whitening, you see the results almost immediately, especially with the patients that have tetracycline stain. The darker the stain, the happier the result. So I often see a patient will come in and they're just unhappy with their teeth. In fact, that's the number one complaint we get from patients is that they're not happy with the shade of their teeth. But as soon as they leave with that power bleaching appointment, their ear to ear smile, and they just, I mean, they couldn't be happier, especially those ones that felt like they were hopeless and they could never achieve a wider smile. So you see it often. You see it in their posture. You see it in their smile. You see it in their confidence whenever they're speaking to people. It portrays differently in every person, but you can see the confidence boost almost immediately after you see the whitening. So when we look at whitening and we look at the candidates for whitening, we look at a couple of different things. Most patients are candidates for whitening. However, there's a couple of things that you want to keep in mind. One, if you have large restorations in your mouth, especially in the front teeth, those aren't going to whiten. We may look at rechanging or changing out those composites in order to match your new tooth color. Crowns and veneers, if you decide to whiten, those will never whiten as well. And again, if those crowns or veneers are already whiter than the rest of your teeth, that's great. But if they're darker and we whiten the rest of the teeth around there, we're probably going to talk about changing the crown or veneer to match your tooth, your new tooth color. So when we're looking at how are we going to whiten or where we're going to whiten, we look at those things. And lastly, we look at wear. How much wear do you have on your teeth? If you've worn out the outer layer of your tooth and you have the next layer of your tooth exposed, which is the dentin layer, it's going to be very difficult to just whiten that part. And so you may not notice that yellow layer whiten, especially if you're using any kind of product. So after professional treatment, and if you want to touch up your whitening, you do leave with custom trays, and we also provide you with a syringe. That way you continuously whiten your teeth after you're done. And you could always purchase extra syringes. Again, this is specifically towards core whitening. This will continue to allow you to have that white smile that you've already achieved. And so that touch up will just continue, and you can even whiten beyond that if you'd like.